All right, we are going to get started here. So today we're going to talk about the changing COVID-19 and the impact on your life. For those of you who are new to the presentation, my name is Dr. V and Balda Crowder, and I'm an emergency medicine physician. I've been an emergency medicine physician for 30 years. This is my fourth pandemic. And the information for this presentation is on my website, AskDrV.us. All of the resources, all the literature. One of the things that we're going to add tomorrow to the website, which is going to be really good, as I started reading it today, was all the CEOs of the major pharmaceutical companies gave testimony to Congress. So their written testimony, it will be on the website probably by tomorrow afternoon. You can also tweet at me at AskDr_V. All right, so the structure is 10 to 15 minute presentation, then followed by Q&A. We usually end right at about 9 o'clock. Sometimes we end a little bit earlier, depends upon the number of questions that we have. We take written questions first. So anyone that types a question in the Q&A or types a question in the chat box, those are the questions that we go to first. During the presentation, everyone will be in listen mode. And then after we answer all the questions that are written, we can sometimes take people individually off of mute to actually ask their question live. So feel free to type in your questions as we go. All right, the intention of this webinar is to keep everyone informed on COVID-19 families so that they will keep themselves and their families safe. The outcome is that they'll leave the webinar and they'll be motivated to create an action plan. And you will adjust your action plan from time to time as things happen and new information occurs. Some people may also be creating an action plan for a broader community, a homeowners association group, a condo building, a union, etc. All right, after 99 days, 1 million Americans became infected with COVID-19. It took just 43 days after that for the United States to reach 2 million. 28 days later, we reached 3 million cases of COVID-19. And 2 weeks later, which was today, we actually crossed the 4 millionth mark. So we now have more than 4 million cases of COVID-19 in the United States. As you can see from this timeline, we're actually adding 1 million cases faster and faster and faster. So this is really something that everyone should be paying attention to. Now, I'm going to just go over a little bit for those who haven't been on this presentation before. This is a droplet disease. We tell everybody to respect COVID-19. There is also some airborne component. It does stay on surfaces for long periods of time, cardboard surfaces for 24 hours, plastic surfaces for 96 hours. Highly contagious. COVID-19, minimum time of exposure to infect others is 45 seconds. When you actually look at how many people get infected when 100 of them have become exposed to COVID-19, it's about 60 to 80%. I apologize for my dog in the background. Let's just talk first about droplet versus airborne. Droplets are larger particles, and they usually fall within 3 feet. That's why we had the initial recommendation to only stay 3 feet away from people. What we have found is that COVID-19 transports not only as a droplet, but it also transports as a smaller particle, which is airborne and can travel long distances. So I just show here an example. Ebola is a droplet disease. It's very big, very heavy, falls within 3 feet. Measles actually spreads out into the air and is an airborne disease. So we're not sure if COVID-19 is actually spreading by micro droplets or if it becomes aerosolized and becomes airborne because of heavy breathing or certain actions. We do know that certain things actually lead this particular particle to stay in the air longer. So exercise, singing, blowing through instruments, those sorts of things. This is one of the reasons why I also put in this slide to actually make sure that people do not use their nebulizers at home if they have asthma. You cannot tell the difference between COVID-19 and an asthma attack because it can present very similarly with coughing or shortness of breath or wheezing. And if you are COVID-19 positive and you use a nebulizer, then you have definitely made it airborne throughout the home. So if you live with other people, it will more easily infect other people. So we recommend that people actually use their inhaler with a spacer. The device here to the right is a spacer. And that spacer then can deliver the same amount of medication as a nebulizer machine. So the CDC says US could get control of coronavirus if everyone wore a mask for 1 to 2 months. So we're going to use this particular presentation today to really do a deep dive on masks, because I get a lot of questions about the mask. So first thing is this gentleman here. His name is, whoops, sorry about that. His name is Peter Tsai, and he is the inventor of the N95 mask. And what I want to do here is just play a little video of him. It's very short. It's only about 2 minutes. And hold on just a second. He basically came out of retirement, and he talks a little bit about how he invented, oh gosh, maybe this is not going to work. Hold on just a second. All right, let's see here.
I will regret it in the rest of my life, because people are dying. I grew up in Taiwan.
We're having a problem with sound, so I'm not going to actually, what I'll do is I'll put this actually on the website. But basically, he's from Taiwan. He actually came to the US to get his PhD, and he actually developed the electromagnetic film that is on the outside of the mask that actually allow for particles to attach to it. So what I'll do is I'll put this, he talks about coming to the US and deciding to go to college in the US, and when he began actually looking at this. He never had actually considered looking at this for medical use. He was really only looking at it from an industrial perspective, sort of people work in dusty work environments. So I will add this link to the website. I thought we could possibly show it. So basically, he talks about this electrostatically charged fabric that he had invented, and that is what actually attracts like magnet particles to the outside of the mask. And this is why it's so important when we actually talk about masks that people don't touch the outside of their mask. Right, his recommendation is to get 7 N95 or KN95, or you could also get an N99 mask, whichever one you decide to get. We'll talk about the difference in a little bit. But get 7 of them, use 1 of them for each day of the week, hang them up, let them sit for a week, and then that would be enough time for the virus to be deactivated. And then you use Monday again on the following Monday, you use Tuesdays again on the following Tuesday, etc. So there's basically 4 types of masks. There's, in addition to the just regular homemade mask or surgical mask, N95, KN95, N99s, and P100s. So if you look at it, the N95 masks are actually FDA approved, and those are masks that are used in the healthcare field. KN95 masks are very similar. They're just what was made in China, and they're not FDA approved, but they're very similar. And in China, their KN95 masks are approved to use in a hospital. Then there's N100 mask or P100 mask, which are very, very similar, and they block out basically 99.9% of particles, anything that's 3 microns or larger. So let's take a look at what these look like. So here are the N95 masks. They're different. They don't all look like this, but this is what some of them look like. Again, they come in different sizes and shapes. You're usually fit tested for them. This is what an N99 respirator mask looks like. You've seen some of these worn on, you maybe have seen reporters or someone wearing these. This is an N100 mask. These are the P100 respiratory mask. Right, I have one of these that I use. I have one that looks a little bit like the one in the middle. All right. So now, how do you properly wear a mask? You want to make sure that you are covering your face from the bridge of your nose all the way down to your chin. It should be loose fitting, but still stay securely in place. You should be able to talk with the mask on, and it shouldn't irritate you, or you don't want to be tempted to kind of touch it or pull it out of place, or you don't want to constantly be moving it. Now, the guidelines to properly wear a mask: you wash your hands. Again, we always touch the mask at the string that is going behind your ear. We do not touch the mask at the outside of the mask, because that is actually where the particles are that are infectious. Right? Make sure the mask fits and covers your nose, mouth, and chin. Make sure you can breathe and talk comfortably. You can wash some reusable masks if you actually want to wash them after each time. If they're disposable, then obviously discard them. Now, things not to do. It's important that you don't touch your mask from the outside. You don't touch other people's masks from the outside. You'll see people in slide 2 where they kind of pull it down underneath their chin. You don't want to do that. You don't want to leave your nose or your mouth uncovered. And you don't want to remove the mask while you're in public. And you also don't want to remove the mask when you sneeze or cough, because that also, that kind of defeats the purpose of the mask. So you want to go ahead and sneeze or cough into the mask. The major points are filtering 100% of the incoming air, layered fabric, proper fit, proper size, facial hair. It's important to have no facial hair because the mask fits better if there's no facial hair. Facial hair also actually accumulates viral particles. So, if at all possible, you want to get rid of any facial hair. You want it to be comfortable and have some sort of metal piece or metal bend around the nose if possible. I got a couple questions last time about face shields and whether or not face shields are as effective as masks. And the answer to that is no. I wasn't sure. I told everybody I use face shields in addition to masks in the hospital setting because we're concerned about splattering. But in Switzerland, they actually did a study and they actually looked at face shields without mask, and they were not very effective at all. And so if you're going to actually use a face shield, you use a face shield in combination with a mask, which is shown here in the photo below. Now, what difference do they make? Well, it depends upon who has the mask on. So out in the normal world, you do not know who has coronavirus and who does not have coronavirus. You don't know if you have coronavirus. So what we did was we did this slide here. On the left-hand side is a person who has COVID-19. On the right-hand side is a healthy person. If the healthy person has on the mask, the transmission probability is 70%. If the coronavirus 19 person has on a mask, the transmission probability is 5%. If both people have on a mask, the transmission probability is 1.5%. So when you wear a mask, you're protecting the other person, and when they wear a mask, they are protecting you. So that is basically how it works with the mask. All right, now, one thing that I wanted to talk about, which we have not had a chance to talk about, and we're starting to see this more and more, are the long-term effects of COVID-19, right? So one of the things that we're seeing is what we call post-intensive care syndrome, and that's where you either have cognitive, mental, or physical impairment. About 75% of COVID-19 patients recovering from the ICU experience post-intensive care syndrome. You also have renal failure, a lot of dialysis, chronic dialysis. Some patients may wind up needing transplants, limb amputations, as we saw with Nick Cordero, the Broadway star who passed, but prior to passing had his limbs amputated as a result of blood clots. Strokes, we're seeing a lot of strokes from the clotting in young and old. About 50% or so of young patients are not able to return to work. And then pulmonary fibrosis and decreased lung capacity. So about a third of the patients are reporting difficulty breathing with normal activity, months after catching COVID-19. Walking a block, house cleaning causes shortness of breath. So this is really, I know there's a lot of focus on how many people have died from the disease, but one of the things that we're going to be taking care of a lot, we're going to have a lot of COVID disabilities moving forward as people get this disease and then don't die, but recuperate with some of these complications. All right, get a lot of questions about vaccines. I want to just a couple of slides on vaccines. These are sort of the phases: exploratory, preclinical, clinical, phase 1, phase 2, phase 3, regulatory review by the FDA, manufacturing, quality control, and distribution. So as you can see, there's a lot of different phases to this. And then when you get finally to distribution, usually what happens is they will do distribution with essential workers first, and then do distribution also with people who are at high risk first. So there's about 80 vaccines that are in various levels of development. This month, we haven't added, but this month we had several of the vaccines start in their phase 2. And so when you actually see on the website the CEOs of AstraZeneca, Visor, and Moderna speaking before Congress, they actually report in those testimonies the results of their phase 1 and phase 2 studies. So one of the ones that everyone's been looking at is Moderna. They're the ones that Dr. Fauci and NIAID is working with. Again, they were able to really jumpstart this because they had been doing a lot of work with the SARS, for the SARS vaccine, which was SARS and MERS, which is a similar vaccine to COVID-19. This is a 2-part vaccine. You have to get one vaccination, then in 28 days you get another vaccination. They are enrolling in this month. They've started accepting patients. They're enrolling 30,000 volunteers into this particular trial. Alrighty, now let's just talk about indoor spaces, because the fact that this is airborne basically kind of cuts out movie theaters, right? Any place where you sit inside for a long period of time. Cuts out church as well, another place where you sit inside for a long period of time. Gyms. Some people are doing modifications on gyms. I really recommend, and these are some of the modifications that folks are doing. I think it's really just much safer to just, exercise outside, whether or not it's running or jogging or playing tennis or golfing, or anything that you can really find that you can do outside would be much better than being inside of a gym. Office spaces, I really recommend that most people stay out of their office spaces, particularly if their building is a large number of people in a building. They have found coronavirus in air compressors when they're testing air compressors in large buildings that have large amount of people. And so we really do need to telework until we get vaccinated, particularly if you have risk factors. Schools. There's been a lot of talk about school reopening. No schools or no country has reopened any of its schools with the degree and the amount of infection that we have, with the amount of community transmission that we have. The places that have reopened their schools are countries that have actually gotten their transmission rates down significantly through a lockdown, a coordinated nationwide lockdown, universal mask mandates. And then when they have actually gotten the schools back up and running, They've used partitions like you're seeing here. All of the students have on masks. They often set the kids up into various different pods so that there's less interaction, and cut the class size down to about 10 to 15 students. So the American Academy of Pediatrics created a lot of different recommendations as it relates to education, nutrition, special populations, athletics, mental health, group sizes, etc. And basically, I'm not going to go through all of these recommendations, but basically what they're doing is significantly decreasing class sizes, creating hallways so they go in one direction, creating kids into cohorts or pods where they then eat with that same group, go to school with that same group, go to recess with that same group. So there's less people interacting with each other from different pods, and doing things like that. And so that will make sense once we actually get the community transmission right now. So considerations for going back to school is, what's the infection rate in your community? The community that has the highest infection, the highest positivity test rate is Nogales, Arizona. And a COVID test done there, about 55% of them are turning positive. Other places have very high, I think Florida's in the 20s or 30s. So, you want to actually have a test positive rate that is definitely less than 10%. And that's really, really important. You also want to make sure that you have contract tracing in place, and you want to make sure that you're able to get rapid testing. The test where people go get a test, they don't get the results for 7 days. There's very little you can do with that because you can't contract trace. People will not often quarantine if they're not sure that they're positive. The other things to take into consideration are, what is the age of your children? How mature are they? Are they able to really follow instructions and keep a mask on throughout the day? What are the age and conditions of other people that live in the home? Do you have a multi-generational household where you have aunts and uncles and grandparents? And so those are all things that may make you want to consider homeschooling your child. So what countries have done is they've dramatically decreased their community infection rate. That's goal number one when they opened up preschools. They've decreased class sizes, moved desks far apart, removed public water fountains, provided PPE for teachers, administrators, and staff, more frequent cleaning of the rooms, offices, and buses. They've installed more cleaning stations, and they also have done temperature testing of all students and staff on a daily basis, with people being sent home if their temperature is below, if their temperature is above like a 99.5. All right, so this COVID risk test, this COVID risk chart was put together by the Texas Medical Association. This is also on the website. If you want to print it out and have it with you, this kind of goes over common activities that we do and which things are more risky than others. So a 9, which is high risk, is going to a bar, working out at a gym, attending a church service with over 500 worshipers, any sort of large music or sporting event. A 6 is sending your kids to school, daycare, or camp. So that's actually pretty high, as well as working a week in an office building, having dinner at somebody's house, going to a shopping mall. 4 is eating at a restaurant, walking in a busy downtown, grocery shopping. 2 are things like playing tennis, pumping gas, and 1 is like opening up your mail in your home. So this just kind of, this list of activities kind of gives you an idea of what's high risk, what's medium risk, and what's low risk. Now, just a little bit of good news. This is a home COVID test. This is being tested in Australia with very, very good results. And so kind of excited about this. This is almost similar to how you would check your blood sugar at home, right? So it is a home device. That little area there with the blue drop is where you you spit into that. So there's no sticking of any swab up your nose or anything like that. So you spit into that, and then it actually tells you if you're positive or not. They've been using these as a way of where people can kind of do this, and then they show the results before they go into a movie theater or a play or something like that. And this sort of it's a strip, and that strip is then dated with today's date. So those are things we may see in the future as things that may be used while we are trying to get a handle on this infection and get everyone vaccinated. All right, so we are going to go to Q&A, and I have with us today Gary Carter is a safety engineer. He helped us with a lot of the mask slides and the information on masks. So he and I will both be answering any questions around mask. All righty, so if you have any questions, you want to put them in the chat or actually type them in the Q&A. Alrighty, Gary, I'm going to promote you to panelist, and then when we have any questions on mask, I will unmute you. Alrighty, what do we have today as far as questions? Okay, here comes some questions in the Q&A. Alrighty, so here's our first question. Would you recommend wearing a mask when riding a bike or running for exercise? So, you know, that's interesting. So it kind of depends upon how crowded is the area that I'm riding a bike or running in. So I personally don't like to actually exercise with a mask on. So what I try to do is I actually try to take my nature hike and my bike rides during time periods when there are very few people on the trail. So I'll go earlier in the morning, like maybe 7 or 7:30 in the morning, so that then I'm actually exposed to fewer people. I always have my mask on me, but I don't necessarily wear it if I go early in the morning and there's not a lot of people on a trail. But if it's a crowded trail, I definitely would put a mask on. All righty, let's see here. Here we go with our next question. Should I wear a visor while at dialysis? I wear reading glasses while I'm there. Okay, this is actually a really good question. Okay, so if you're somebody who gets dialysis and you wear reading glasses like these, they have plastic things that you can actually put over the side of your glasses like this and this, right? That will make your glasses almost like goggles. And so it's a plastic piece that kind of goes from here to here, and then you have your glasses, and it actually provides you very similar protection from any sort of splatter. The visor is primarily for things splattering. You can get coronavirus through eye fluids. So you can put those little plastic things on, or you could use a visor, whichever one is more comfortable for you. A great question. All righty, what else do we have here as far as questions? And if you have a question that you want to ask, what you can do is just, I think there's a raise hand feature where you can raise your hand. And then that way I can actually see you. All righty. Any more questions? Let me give people time to type. Okie dokie, here we go. Let's see here. What country is the home test being used in? So it's actually being, that home test for coronavirus is actually being, it's an Australian company and they're testing it in Australia. And they haven't actually used it for, they haven't actually yet circulated it for widespread use. I'm waiting for the actual study to be published, but they released some preliminary results, and that's how I found out about it. And also too, that home test, they're saying that it is less than $10, so it's very, very affordable. In fact, they said it was, I think the strips are between, I don't know, $2 to $5 or something. So it's actually supposed to be very affordable. So it's not being used yet in Australia, it's being tested. So yeah, it'll be interesting to see, but I think they're gonna report out probably in the next 30 days, the results. And then we'll see what happens from there. You are welcome. Now, how is everybody doing on masks? People are finding masks and getting masks and. Okay, all right. So, all right. Here's another question that we have. My son is going to an amusement park against my wishes. He states he will have gloves, hand sanitizer, and a mask. Is there anything else to do? So gloves have been found to be a little problematic. So what happens with gloves is because most people don't know how to really wear a glove, or they forget they have the gloves on. People often cross-contaminate themselves with gloves. So what happens is they have their gloves on and then they touch their face with their gloves, right? Or they touch their mouth or they touch their nose with their gloves. So I would actually prefer they leave the gloves at home and take lots of hand sanitizer. And then also the mask. The other thing is there anything else to do? I would also say, you know, I don't know if he's, you know, how many people is he going with? What time of the day is he going? Is he going on a Saturday when it's going to be crowded, or is he going maybe during a weekday? You know, you can always look at something that is sort of risky and make it less risky by the time of the day that you actually go, or how many people that you actually go with. The other thing that I think would be important, I know some of the amusement parks have actually closed some of their water rides because they've been concerned about the water rides being an easy way to transmit COVID. And then the other question, I guess, about him is after he goes to the amusement park, who does he live with? Is he coming back to your house to live? You know, or does he live by himself? So that's also important. You know, if people want to take risky behavior, that's one thing. It's just when they come back and then they live in a household where there's others that may not be able to take that risk. What types of masks? Okay, next question. What? She said 8 people are going. Well, yeah, that's. You know, they might want to actually, you know, 4 people go this direction, 4 people go in that direction. But yeah, I just, yeah, the amusement park is I'm actually really surprised in a lot of areas that they're actually allowing them to stay open. Okay, all righty. Gary, can you unmute? I got a couple of mass questions.
Okay, I'm ready.
All right, where can you buy the where can you buy the N100 mask? Yes.
Okay, when you buy the N or P100 mask, those are normally if they have the rubber seal for the tight fitting face piece, you should know what size you are, small, medium, or large. Down here in Georgia, we have Caduceus, one of the med centers. Call the local med center, make sure they can do fit testing. They should have at least the 3 different types well, the 3 different sizes, small, medium, and large. They should also have them in different types. Now, when you're talking about the tight-fitting face pieces, you want to talk about affordability. The half-face mask normally come between $25 and $75. Depends on which one you like. And then the filters, because you want to buy the right type of filters for the type of contaminant. You want to buy the purple, magenta for the particulates that we're trying to prevent for the COVID.
Okay. Okay, so we want the purple filters.
Purple,
Oh, that's interesting.
purple
I have
filter.
the purple filters. Yeah.
Those for the particulates, dust. If you got fumes for smells, you want to have black. And if you're in an acidic work environment, you want to have yellow.
Yep. No, we want the purple. We want the purple for COVID. I got my N100 mask. It was by Sperian, Sperian. It also is on the website. I got it on eBay, and I think I paid about $80 for it.
You can also go to Granger.
Yep.
But you want to have somewhere you can get the right size first.
Okay.
So that's very important.
All right. Then another question we have is, what type of mask should be worn for a 3 or 4-year-old?
I would probably need Dr. Valda to verify this. But you're talking about kids, because they're saying some kids 2 years or younger, I've read that maybe they shouldn't wear a mask. Now, but any type of bandana or something that you can wrap around their face, the most thing with kids is that it needs to be comfortable. Because if they're going to go to school, it's something they need to be worn all day long. And you should test that at home days and stuff before get them in the mindset of doing or wearing it all day long. That would be my recommendation.
Yeah, I was going to say, I kind of agree with you. I think that, some of the fabric ones, are good enough for kids. You know what I mean? Particularly if it has some sort of print on it that they, a cartoon character or something that they like, that they may then want to wear. Yeah, exactly.
And if you have a seamstress, I highly recommend you get something to go to them. And if you can make it something that can match their outfits or like their cartoon character, it can be they'd be more apt to wear it instead of taking it off.
Right. All right. So now there's a question. Are there any health risks for wearing a mask over 10 hours? Now, this is kind of interesting because, when you're working in the hospital setting, we're normally working 12-hour shifts. So in those settings, we have a mask on for a very long period of time. I find that I can actually wear a mask like maybe for about, 3 or 4 hours. And then what I do is I step outside into the ambulance exit and kind of take it off and massage my face. So you'll see on Twitter and Facebook, a lot of the nurses and doctors, they almost have imprints from the mask. And so it's more that you kind of get that type of an imprint, but I don't know of any particular health risk. What they are doing for nurses that are like ICU nurses and they're in the rooms constantly and they're also working 12-hour shifts, they almost wear, they're not even wearing a mask. They're wearing basically almost like a moon suit. So imagine it pumps in air. So it's like literally a moon suit. And then there is a something that pumps in air and exchanges air so that they can move around and take care of these patients for long periods of time. But I don't know of any health risk associated with masks. Do you, Gary? Do you know of any health risks associated with wearing masks for a long period of time?
Prior to 2000, I was working at a nuclear facility where the guys would work 12 hours a day wearing a mask. I've seen some stuff on social media, et cetera, on websites that you're breathing back in carbon monoxide. I never found that to be a problem with the tight-fitting face pieces.
Right.
So with the N95s, the N99, with the mesh that you're breathing through, that should not be a problem.
Right.
So
okay.
That should not be a problem.
All right, good. Okay. On Tuesday, somebody mentioned Artemisia annua. I do not, I have a call out on that, but I do not have any additional information yet regarding that. I'm hoping that the that the doctor from Wuhan will get back to me by next week. So I do have a phone call out on that, but I do not have the answer yet. But thanks for asking. All righty. Let's see here. Is it safe to get your teeth cleaned? So, you know, it's interesting. I have a lot of friends who are dentists, and I was just talking to one of them last night, and I sort of asked her how things were going for her. You're more likely in this setting, because your mouth is open, to actually give coronavirus to your dentist. I did hear of a dentist in Chicago that was doing a rapid COVID test on site, and would get the results back before then she would work on you. That's actually, you know, now that's actually, I'd probably feel safer going to that into that sort of setting, but most of the dentists are not doing that. But what most of them are doing is they're sort of eliminating the waiting room. They may not polish your teeth afterwards, because that actually creates a lot of splatter. So I'm seeing the dentists, you know, amend their procedures, and I think they're in general doing a very good job. I have something that I need to go to the dentist for. I haven't had the courage yet to go to the dentist, but I'm feeling a little bit better about what I'm seeing and what I'm seeing them doing, and I'm actually, you know, I'm looking to go before this year ends. I think that if you're going to do something like a cleaning, you know, maybe you might not go as frequently. That's kind of what I'm doing also with my hair. I'm not going as frequently to sort of mitigate the risk. Someone asked, I noticed that I drool when wearing a mask. You know, that's interesting. So you do kind of get more secretions and stuff when you're wearing a mask. Like for me, I noticed that my nose runs. And so sometimes I have to take the mask off and wipe my nose or blow my nose. So it does actually increase your secretions. All righty, let's see here. See if there's any that I missed. Okay, so someone is asking here, oh, okay, so the person who asked the question about dialysis, she said that the techs are wearing visors whenever they're treating, the techs in the dialysis center are wearing visors. So yes, the techs are wearing visors because they're usually accessing your port, or they're doing things that could possibly splatter back up in their face, right? So you're not going to be exposed. If anything splattered, it'd be your own blood, and you're less exposed to splattering when you, let's say you have a port in your arm and they're accessing your port for dialysis. So the healthcare workers definitely need a visor. You not as much. All right, next question we have is, I'm seeing people who don't use gloves still making mistakes without them because they're cross-contaminating and not using their sanitizer. Yeah, I see a lot of dirty masks and a lot of dirty gloves. Yeah, so this and let me reiterate this. I really recommend that people not wear gloves, because gloves give people a very false sense of protection. They often cross-contaminate themselves and the gloves get dirty. So it's better to just use your hands. You're much more aware of when your hands are dirty, and then using sanitizers and soap and water and cleaning them. Yeah, there are a lot of dirty masks. I agree. But the mask is actually, you know, their issue with their mask being dirty is that they're more likely to contaminate their fingers, depending on how they take it off. It doesn't necessarily, you know, the effectiveness of the mask doesn't really vary that much just because it's dirty, but it does cause cross-contamination problems. Any recommendations, Gary, on how to clean a mask?
Okay, cleaning the mask.
Yes.
I don't have any. I have the disposable kind, or I have the kind that just the filter can be replaced, and I can wipe them
Okay.
off with
Okay.
disinfectant
Gotcha. Okay.
and have the
All right.
replacement
Yeah.
cartridge
Yep.
on the inside. I prefer those.
Okay. All right. And I know mine is a silicone respirator mask, and I just spray it with Clorox and then dry it off. So that's actually what works for me. So. All righty. Any more questions?
Doc, I have one for you. When you spray them
Sure.
with Clorox,
Yes.
how long do you have to let them dry? Does the will you smell the Clorox afterwards with breathing the Clorox fumes?
You know,
bother you?
you know what you do? Yeah, you do smell that Clorox for a little while. Yeah, yes, you do. So what I normally do is I try to, I don't spray it and then let it air dry, because then I notice that I do smell more Clorox. So I spray it and then kind of wipe it down with paper towel. And sometimes I've actually even just run water on it afterwards to get the Clorox smell out of it. But yeah, no, it does. The Clorox smell does get on the, especially if when you spray it down and spray it on the inside.
Is it harmful to you? Is it harmful?
Breathing in Clorox, breathing any sort of Clorox or bleach it's not harmful in small quantities, but it is harmful in large quantities. So it can cause, in large quantities, it can cause like a pneumonitis, like an inflammation in your lungs. But yeah, that's like as soon as I smell it, I take it off. Then I go up. I gotta wash this a little bit more, clean it down a little bit more.
Okay, and one more thing. So best practices would be always at least try to have at least 2 masks with you. And if you have kids, you may want to have 3 or 4. What are your thoughts?
Yeah, I try to have 2 masks with me, and you're right. If I had children, I would try to have 3 or 4, because even just for instance, I know I was out one time and I dropped the mask on the ground. Do you know what I mean? And I had some place to go. So I try to have a couple of extra masks in the car, or whenever I go out, I try to have an extra mask. Okay, someone said they let their KN95 mask sit in the hot car for a couple of days, and then they steam it for 5 to 10 minutes. Is that okay? So it's interesting. You don't really have to steam it. If it, again, whether or not it's in a hot car, if it sits anywhere, and that's why the inventor of the N95 mask, he recommended buying 7 for each day of the week. Because if you hang that mask up for 7 days, whatever's on it is dead after 7 days. So then you don't even have to worry about it. You don't have to worry about cleaning. You don't have to worry about anything. Just get 7, and this is my Monday mask, and then you just come back to it on Monday. You don't have to worry then about steaming it or doing anything.
I have a question.
Yes.
When just about 2 months ago, I guess, when everybody was quarantined and I was an essential worker.
Yes.
And at lunchtime, I had the autonomy that I was at a construction site and I would go and get stuff guys for lunch. And when they would pay me cash, so I would take the cash right then and put it in the microwave. They would laugh at me. And I would have a joke and say, I don't know where your hands have been. So will microwave kill it?
Yes.
Okay.
Yes. So we were, when everything was, when the medical supplies were short, we were using the microwave in our nursing, in our lunchroom to actually microwave our mask. If we, like, let's say we saw a COVID-19 patient and we couldn't get a new mask before the next COVID-19, we'd go and zap it in the microwave. So yes, it does work. Yeah, that absolutely does work. Okay, somebody asked about wearing masks while dancing, exercising and dancing. Again, I think that would really depend upon, if I was indoors, I would definitely wear a mask while dancing. If I was outdoors, as long as I'm dancing and I'm going to be maintaining my 6 feet of distance, you're fine without one. But if you're going to be dancing and getting up close to someone, like you're dancing with someone, then you definitely want to have on, both parties definitely want to have on mask. All right, we've got some great questions today. Let's see here. Okay. Can the KN95 be washed? I have a friend who's washing them by hand. So yes, so all of the N95 and KN95 masks are very different. So some of them can be washed and some of them can be reused. So I know up at the store where I buy my KN95 mask, those can be, they say on the packaging that they can be reused 20 times and that they actually can be washed. Nurses at Washington Hospital Center are demanding new rather than reused PPE after it's been cleaned. What are the risk factors? So one of the things that they started doing was giving us literally a mask, and we would mark it for Monday, and then they would clean it and give it back to us the following week. And then Tuesday you'd get a mask and clean it and give it back to you. You know, the thing about it is I never did trust that. And luckily I was moving from hospital to hospital, so I wasn't a permanent employee at any particular hospital. And so I did what they call locums work. So they never really had time. I never worked any place long enough to get my other clean mask back. But nobody ever said what the cleaning procedure was. And I was always like, if you're cleaning it, what exactly are you doing? And, you know, no one said, you know, hey, this is how we're cleaning it. And this has been studied or FDA approved or anything. So that was really kind of my issue with it. I was like, I don't even know what you're doing with it. So I agree with them. I would want in a hospital setting, because a hospital setting is much different from, you know, being out and about in your regular life. We are seeing COVID patients, and we're seeing a lot of COVID patients. So, you know, there's no question that our mask and our PPE are contaminated, right? Whereas when you go out in the regular world, you know, you may or may not run into somebody who has COVID-19. So yeah, I think they're right to be demanding new PPE. All righty. I think we've answered everything. Let me take a look here. All righty. And we are spot on at the 8:55 mark. So I do not see any other questions. What I'm going to do hold on just a second. I've got one last one coming in here. Okay, should you remove your shoes after being out? So if you work in a hospital setting or a nursing home or a high-risk setting, you should absolutely remove your shoes. If you're talking about just out in the regular world, it's less of an issue. I actually keep a bottle of Clorox in the where I come into my house, and I just spray the bottom of my shoes, and then I usually don't take them off. I usually keep on trucking, but I do spray the bottom of them. But on the days that I work in the hospital, I absolutely do not bring my shoes inside. Okay, my teenage son goes to visit a friend on his porch, and they both wear masks. Does he need to stay away from the family when he comes home for days? So no, if he goes to the porch and he visits his friend and he wears a mask and stays 6 feet away from his friend, mask and 6 feet away, then he does not need to stay away. And I would also say he needs to be wearing, when you say a mask, I'm hoping that you mean a N95 or KN95 mask. You know, sometimes what I see with the teenagers is they have on something like a bandana. A bandana is very, very ineffective, right? So as long as he's wearing, when you say a mask, as long as he's wearing, you know, a real mask, and not something like a bandana, and he's visiting his friends on the porch. My neighbors and I, we have on Fridays, we have a little happy hour. We get in a circle, we have on our mask, and we sit outside and talk to each other. for about an hour, and then we all go back. And then we all go back home. So we do the same thing, kind of visit each other. So I think that's an okay thing to do. Yeah. So, alrighty. Well, thank you guys very much for being here. Gary, thank you for all your help with the mask and the mask questions, because we really wanted to have this particular session today to really, really, really focus in on masks. One of the things that I want to do next week is I really want to focus in on the immunity and how long the immunity lasts without a vaccine, and some of the information that the CEOs of AstraZeneca and Visor and Moderna actually gave during their testimony this week. So thank you guys very much for coming, and I'll talk to you on Tuesday.